Hello everyone and welcome to this week's edition of Ask the Expert. My name is Ashley Baldwin from the Department of Communications at the Pan American Health Organization, and this week we are going to be talking about what healthcare providers and patients need to know about non-communicable diseases. So I'm joined here today by three colleagues from PAHO, Dr. Anselm Hennis, Director of Non-Communicable Diseases and Mental Health. Hello, how are you today, Dr. Hennis?
Hello, good afternoon. Well, good afternoon to all out there in Facebook Live land. Pleasure to be here and to participate with you.
Thank you for joining us. We're also joined by Dr. Silvana Luciani, who's the Unit Chief of Non-Communicable Diseases at PAHO. Hi, Luciana.
Hi, Ashley. Hi, everybody in Facebook. It's great to be here today with you all.
And last but not least, we're joined by Dr. Gloria Giraldo, who's our specialist in cardiovascular diseases at PAHO. Hi, Claudia. Hi, Gloria.
Good afternoon, everyone. Thank you. Thank you for having us.
So as always with this, we're here to take questions from the audience. So at any time during the discussion, if something arises or if you have a question that you would like to ask one or all of our experts, please feel free to pop it in the comments section, which is to one side, I always get confused, of the little Facebook box, and we'll do our best to try and answer it during the time. If the question isn't related specifically to non-communicable diseases, what we'll do is we'll save it for later. And then when we do our next Ask the Expert that's probably going to be about a relevant topic, then we'll address it then. So to start off, what do people living with a non-communicable disease, or NCD as we call them in PAHO and other health organizations, such as diabetes or high blood pressure, need to know when it comes to COVID-19, Silvana?
Yeah, thank you, Ashley, for the question. And, you know, COVID-19 is a devastating disease that has had an enormous impact on people's health, families, communities, the world. And what we know is that there is a portion of people who get COVID-19 with mild symptoms. A greater portion have moderate or serious complications from COVID-19. And therefore, people are at higher risk of developing COVID overall, but also at higher risk of developing more severe disease. And those people tend to be those living with a non-communicable disease like hypertension, cardiovascular disease, diabetes, or cancer, or chronic kidney disease. It's worthwhile to note that even before COVID, people with NCDs were the primary need in the health services and systems, right? Because there are an estimated 200 million people in our region of the Americas alone that are living with an NCD and therefore at high risk of developing COVID-19. And what we've seen in some countries like here in the United States where we're based is that of those patients with COVID that have been hospitalized, about 40% of them have an underlying non-communicable disease. They also have a higher risk of dying. So people with diabetes, for example, have a 2 times higher risk of dying from COVID than those without diabetes. So there's a tremendous amount of concern of those living with NCDs to develop COVID, but also to develop more forms of disease and have worse outcomes. And so it's particularly important to take care of yourself with all the preventive cautions that we talk about in public health: washing your hands, not touching your face, wearing the masks, social and physical distancing rather, and to be aware of the signs and symptoms of COVID, right? But it's beyond just those with a confirmed disease. It's also those that have a risk factor for developing a non-communicable disease. So for example, people who are obese or people who are smoking, that those also put them at higher risk of developing COVID. So we say now better than ever is the time to quit smoking and adopt a healthy lifestyle.
Thank you, Silvana. So what you were mentioning is that these diseases were a huge burden on health system and accounted for a huge proportion of people that required healthcare before COVID. So now it's even more crucial that these non-communicable diseases such as diabetes, such as high blood pressure, are addressed by health systems and I guess by patients as well to a certain extent. You mentioned that the risk of poorer outcomes when it comes to someone with one of these diseases or with multiple diseases getting COVID-19. Dr. Hennis, can you tell us a little bit about why people with NCDs have poorer outcomes with COVID-19? If you could unmute your mic, Dr. Hennis.
Thank you.
There we go.
Well, again, just to establish a few things, Silvana made the points very clearly about those with NCDs being at higher risk of poor outcomes with COVID, and to really bring home the point that in the region of the Americas, about 80% of our deaths annually, 5.5 million or so deaths, are in people with NCDs. So we already have a huge burden of illness in the region of the Americas. It has huge health systems costs, huge morbidity. It affects development, it affects societies, it affects every single thing. And what you also have to recognize that NCDs are largely caused by lifestyle, by things such as use of tobacco, unhealthy consumption of alcohol, junk food, sugar sweetened beverages, physical inactivity. So these are not really simply the result of what one does, but it is also a result of the environment in which we live and how we react to the environment. And so there are very complex issues in terms of one's risks to NCDs in the first place. And in fact, the region of the Americas is one of the places, particularly in Latin America, where the burden of NCDs continues to increase because of the way that marketing is done to our populations. So really, we have a lot to do in terms of how we change our environment in terms of making the healthy choice the easy choice. Now, again, why do people with NCDs have a worse outcome? There are biological mechanisms and there are also environmental mechanisms. And certainly there's a lot of questions in terms of the fact that the COVID virus binds to an angiotensin converting enzyme, a so-called ACE enzyme, which tends to be in tissues in the lung, the cardiovascular system, blood vessels. And these are linked, of course, to the risk of having many of the NCDs on the line. So there's a potential biological route. Another issue too is that many persons who are on the front line, persons who are working in hospitality, persons who are working in terms of industry where there's close communication with the general public. And there's quite a lot of risk in terms of ethnic groups and cultural groups by virtue of what they do for a living. These people have a higher burden of many of these NCDs and risk factors. And they're also on the front line and they're exposed more to being at risk of COVID. So there are many issues in terms of how people's health risks, people's culture risks, people's environment that tends to underpin why you're seeing a higher burden of COVID-related illnesses in certain ethnic and cultural groups.
That's interesting that you mentioned, Dr. Hennis, that there's a sort of, coming together of a multitude of risk factors, particularly with populations that have NCDs, that it's not just, the NCDs that's the issue, but that these people tend to work on the front lines, tend to be from certain backgrounds. So I guess it's a double and a triple whammy sometimes when it comes to then adding COVID-19 into the mix.
Yeah, exactly as you said. In fact, what we are now seeing, a lot of it is really COVID has been an interplay between infectious diseases, an infectious disease pandemic, as well as non-communicable diseases. It has different drivers. There's social drivers, there are economic drivers, and there are health drivers. So they've all sort of come together in the worst possible storm of overlapping challenges to health, society, and development. So we're really seeing something we've never really witnessed before in this way.
The perfect storm of risk factors.
Storm, exactly.
And you mentioned, Dr. Hennis, that a lot of the reasons behind many NCDs are lifestyle related. You mentioned obesity, you mentioned smoking, you mentioned consuming diets that are high in certain fats, that are high in salt, etc. Which is going to take me on to my next question for Gloria, which is, given this perfect storm that Dr. Hennis mentioned, and given that a lot of these diseases are lifestyle related, what can someone living with an NCD do to reduce their risk of COVID-19?
Mm-hmm. Yes, as it has already been shared, we are, in the presence of this moment, seeing how these forces come together, and the individual is at the center. And where we are fully aware that there are all these environmental factors, we still have a sense of agency, and where persons and individuals can do specific actions to help maintain their conditions under control. So if they already suffer from a chronic condition, be it diabetes, be it hypertension, and others, this is the moment to take to heart the many different actions and advice that we probably might have heard in the past, which is the lifestyle components that have been mentioned, the healthy eating, being physically active, but for persons with the conditions, taking medications on time and regularly. For many, for different circumstances, sometimes we put off getting the refill for that medication because it can wait, because we may not have symptoms currently due to hypertension, or because we maybe have recently been diagnosed with diabetes, and it may not seem as this urgent matter to take care of, and so it's easy to postpone. However, the current situation under COVID-19 should be a push, should be an incentive to help us turn into action some of the advice that we've heard. So in addition to what Silvana was mentioning and what everyone should be following, which is the mask wearing, the hand washing, this physical distancing, persons with diabetes, persons with hypertension need to be also on top of what their numbers are. What if they have the possibility of self-monitoring at home? What are my glucose levels? What are my hypertension numbers? If you have the possibility of staying in touch with your provider, be it via phone, being through your health center when they open specifically for the care of persons with chronic conditions. So all those elements, all those actions will have a major implication on how well prepared you are to sustain and to stand throughout this pandemic. Over.
Thank you, Gloria. I don't know if it was Silvana who mentioned it or if it was Dr. Hennis, but someone mentioned it that now is the time to quit smoking. Now is the time to, look at healthy diet, et cetera, I was wondering, how much will those things go, in the context of the global pandemic that we're experiencing, towards reversing an NCD or towards preventing an NCD? I don't know if that's something that Silvana or Dr. Hennis could answer, or maybe both. But what is the impact? If I'm a smoker, if I'm a long-term smoker in the middle of a global pandemic, listening to this now, hopefully, putting down the tobacco products, how much will that help me when it comes to helping to lower my risk factor when it comes to having severe disease if I were to get COVID-19?
Yes, the short answer, Ashley, is it will reduce risk if you adopt a healthy lifestyle, right? Because it just boosts your immune system, your immune response. And so even before COVID, what we have in the NCD community been emphasizing is the importance of adopting a healthy lifestyle. That includes not smoking, following a healthy pattern of eating, physical activity on a daily basis, not drinking alcohol or reducing significantly your alcohol intake, following a healthy lifestyle. And we know that it's not just the individual behaviors that matter, but it is particularly important what public policies are put in place to create that environment that supports those healthy choices that Dr. Hennis was emphasizing earlier. I think now more than ever, it is urgent to adopt these healthy lifestyle measures. And in addition to that, what Gloria was talking about, the self-management support. So if you are somebody with a non-communicable disease, if you are somebody living with hypertension or diabetes, or you're a cancer survivor, the importance of taking good care of yourself, monitoring your health condition, communicating with your social network and with your health provider to ensure that your disease is well controlled is also critically important at this time. Over.
Yeah. If I may add to that also, because I think there's no time like the present. And in fact, we had a World No Tobacco Day on the 31st of May. And it was very, very interesting what happened, particularly in the Caribbean region, because the campaign that was mounted highlighted the role of the tobacco industry And why I say that is that every year, 8 million or so people who use tobacco products will die as a result of using tobacco products. So when you're losing 8 million of your clients every year, you have to replace them. So how do you do this? You recruit from a new cohort of people, and the companies are recruiting among the youth. So they get to the youth through novel tobacco products or novel nicotine products. So you have all these electronic cigarettes and all these new products that were not available before. And therefore, you're trying to make it attractive and hip, and the way to do it. So a lot of people are now trying to attract the youth. And so the campaign really is saying to youth, don't let them bring you on board, don't let them lure you in, don't let them make you a victim. Be empowered, take a stand for your well-being. So I think even in the time of COVID, what we're seeing is many companies, and I'll highlight the tobacco company, are trying to find ways using the moniker of corporate social responsibility to bring new people in. And mechanisms they're using are things like sharing face masks and also sharing ventilators, and also making ventilators available for people suffering from COVID. So by being socially responsible, it is a way to try to sanitize reputations and to get new clients on board. And this is not just for tobacco. For example, there was a French study published that suggested that nicotine use was helpful against COVID. It was discredited, of course, very quickly. And then, of course, there are other studies suggest that alcohol consumption would protect you against COVID. So there are many things that were happening in a way that we've never seen before, which have the impact of luring people in and trying to weaken regulations to protect the public health in terms of making us more exposed to harmful products like alcohol, tobacco, junk food, and sugar sweetened beverages. Because when you're at home now and you're in lockdown and you can't get access to things that you would wish to have, like alcohol, excuse me. There are cases in some of the countries whereby delivery of alcohol was actually allowed. So there are many things that have to be done to protect the public health. And so even while we are battling an epidemic, we're trying to promote good health. We also have to ensure that people have access to healthy options, irrespective of circumstances. And therefore, we have to ensure that many of the gains in public health are not rolled back because of under the guise of COVID. And this is an ongoing battle in the interests of public health. It doesn't end one day. So people have to be vigilant. Also, governments have to be vigilant in taking decisions to protect their health and well-being and the wealth of their economies through appropriate public health measures.
It's interesting what you say, Dr. Hennis, because, we've moved from, of course, there's a level of taking responsibility for one's own health. And now is the time to quit smoking. Now is the time to not drink alcohol. Now is the time to focus on having a healthy diet. But it's also crucial that governments during this time, particularly within the context of a global pandemic where these groups are at risk of the perfect storm, as we mentioned previously, that we have the measures needed at a political level to implement tobacco control and to make sure that people have access to the facilities and the care they need to make those decisions. It's not just personal responsibility, it's also about facilitating that, I guess, as well. We've had a question come in. I don't know if Gloria, did you want to add?
Oh, very briefly in this important topic of is it reversible? If I'm already a person that is experiencing some issues with weight and you already might have been diagnosed with pre-diabetes, the good news is that yes, it is reversible. Yes, there are things that can be done. If you are at that stage of pre-diabetes, losing about 5 to 7% of body weight. I know that it's easier said than done, but because this is a wake-up call for everyone, it might be seen as an opportunity to make those changes. Yes, especially around chronic conditions, because you would be living with this condition for the rest of your life. Same with, you won't reverse hypertension per se, but you, with some changes around what you do, if you watch, you're more mindful about the salt intake, more mindful about, again, we mentioned taking your medications, keeping on top of what your numbers are. There is you can control and you can live healthy lives even if you have a chronic condition. So I just wanted to add that to your point of reversibility. Over.
Thank you so much for that, Gloria. So I guess these are decisions that everyone can take now, which are going to impact severity of disease when it comes to COVID-19, but are then going to have, once we've overcome this pandemic, hopefully sooner rather than later, a positive impact on lots of other aspects of their health in the future. So let's talk a little bit about accessing healthcare for patients that currently have an NCD. So we know that with COVID-19, there are limitations to, be able to visit the doctor in some countries, to be able to visit a hospital in some countries. Silvana, can you talk a little bit about, for people who need continuous care to manage their NCDs, how has the COVID-19 pandemic affected access to these services?
Yeah, thank you, Ashley. It's an important question. And even before COVID, we had challenges with health services not necessarily being accessible for all in terms of providing diagnosis and treatment for those with NCDs. And then the COVID pandemic just shows the gaps and the fragmentation of services even more so because it is really stressing the healthcare system. And one of the stresses that has had an impact on the services for people with NCDs as a result of COVID is simply interrupting the service, right? Where centers are closed because there's restrictions in movement or because health personnel have been redirected away from primary care and NCD services over to the emergency response to be able to have sort of all hands on deck, if you will, to respond to the immediate or emergent need of COVID-19. And so we did a small survey together with ministries of health throughout the Americas region. And what we found is that the majority of countries, health personnel were redirected towards COVID, services were shut down. And even when they were operating partially, there was less attendance from the population to the clinics for fear of getting COVID, right? So people aren't going even if the services have been maintained open. But times of crisis like this lend itself to innovations and opportunity to try to deliver services in new ways. And what our survey revealed is that new approaches using telemedicine or phone consultations, lengthening the prescriptions from 30 days to 90 days so people don't have to go to their pharmacy, that all of these new ways of working that were there before, but perhaps not as urgently needed as now, are now being put in place as a stopgap measure, and we're hoping will still be put in place, because I think what we are concerned about is all of the interruptions in services to primary care to be able to monitor and ensure control of those with NCDs, but also, for example, the higher level services like cancer surgery or chemotherapy that have been stalled or interrupted, the impact that that's going to have on patient outcomes over the long term. And so, it is urgent to kind of have these stopgap measures and to reduce the time of interruption of services.
So we've had one question come in from the audience, and of course, if you have any other questions during this chat, then please don't hesitate to ask. There's no question too small. But Dan Epstein has asked, and I think this relates a little bit to Gloria's point about the need for people with an NCD to monitor their numbers, to stay on top of what's going on with their health. But in areas where health facilities are closed or there's limited hours, how else can people access advice or care? What should patients be doing in these contexts? I know here, for example, in the US, that there's an emphasis on telehealth, et cetera, et cetera. So I was just wondering, what that's like in other countries in our region.
Okay, well, I think certainly there have been efforts to institute telehealth in many different settings. This has been new for many, many health systems. The differences, of course, between the private sector and the public sector. Now, in this survey that Silvana spoke about, a number of countries said that they were using telehealth. But when they asked the next question, how available is telehealth? Where do people actually have access to it? You get a very clear sense that there are a number of divides. So, for example, some of the Latin American countries, telehealth might be available in a few cities in the principal state, for example. Then again, there's an urban-rural divide. So persons who are farther away may not have access because of a lack of infrastructure and telecommunications. What we're also learning in the Caribbean, for example, is that the technology may not be easily accessible in homes. And then, of course, the bandwidth may be very limited. Then, of course, in many settings, people have never used telehealth before. So even the basic rules of what does one do are not in place. So coming out of this now, there's a response in terms of trying to strengthen and give guidance for telemedicine and telehealth. And we're working very, very close with colleagues at headquarters at WHO in terms of how to develop standardized operating protocols and procedures for telemedicine. How do you get offices up and running with telehealth delivery in a fairly effective and efficient way? So in other words, there are settings where it's working very well in the Caribbean and other countries, and settings where it's not working so well. We recognize there are huge gaps. But I think looking forward, this is a big part of our new reality. And therefore, we're working to find ways to strengthen the capacity to deliver effective telehealth. Now, even as I say that, the whole issue in terms of telecommunications, which is another limb of it, which needs to be in place, infrastructure development, access to computing and management, all the other things I alluded to, also have to be developed in hand with this. But this is going to be part of the challenges for many countries going forward, effective delivery of telehealth. That's at one level. What we're also seeing is in terms of access to consultations. And there's this novel way of providing support through bots. So in other words, you may not have access to a doctor or other healthcare provider, but there actually are artificial intelligence mechanisms through which one can have counseling on how to cease for tobacco cessation through virtual humanoids. So these are all very innovative and interesting models that are being developed now to continue to provide care in the absence of doctors. But coming back to the point at hand still, if you're ill, you need to access a doctor or get access to your healthcare provider to seek the care you need. And what I will certainly say is that even when clinics might have limited opening, or they may not be open at all, there are mechanisms in place in every setting whereby there's some backup system in place. It's hard to say specifically what exists in every particular setting, but I'm pretty confident that there's always a mechanism to access care, even if your usual services may not necessarily be as available as they are before. Mm-hmm. But so it then behoves the consumers and the clients to find out what systems remain in place, what are the effective healthcare delivery systems that they can still access, because healthcare continues to exist in the countries.
Mm-hmm. So I guess our overarching message is you need to seek care if there's something wrong. Yeah.
Don't delay and say there's no care. You find out how to get it. There are emergency numbers. There are numbers for hospitals. There's care in the public and the private settings. Make sure you get the care you need. Don't stay at home and say, well, there's nothing there. I'm not going to do anything in response. Mm-hmm. And we are having evidence now that people stayed away from healthcare systems, and there are data from the US now about the impact on other mortalities because people did not seek care really because of fear. Now, these are things that we had not seen in the past. So we're undergoing different approaches and different ways of considering problems that we never had to address before. So there are many lessons to learn.
Mm-hmm. And I'll just add that along the line of this innovative and ways that mechanisms that might have been there but are now more relevant than ever as telemedicine, we also need to strengthen the partnership between the providers and the patients. And for example, if before I comfortably went to see my provider and my blood pressure was measured at the clinic, I never really had a sense or an urgency to learn how to do it myself. And in some places, it's also difficulties in access to having your own equipment at home for many different reasons. However, if any initial nascent way of telemedicine is implemented, where it may just be a call from your doctor to check on how you're doing, it would be great that you may have been able to have your measurement to share with your doctor. That also entails writing it down, having mechanisms to remember, because we relied on the clinical chart when we've been at the doctor. So of course, this is nascent mechanisms. This is going to be evolving, but it does also exalt us to work on those partnerships and strengthen patient empowerment, as well as working as a team with the providers. Over.
Thank you so much for that, Gloria. We've had another question come in, which is related to stress, actually, which is something, you know, there's a bit of an overlap, it seems, between this conversation that we're having and some of the conversations that we were having with our mental health specialist as well, particularly when it comes to alcohol use, et cetera, et cetera. But when it comes to stress, the question is from Arancha Cachon: my dad has hypertension, but with all the stress and changes that he's experiencing during the pandemic, he's forgetting to take his medicines. Is that okay? Or should I encourage him to be constant? And just to broaden that question a little bit, how is stress impacting on patients with NCDs, and what do we advise?
I'll start and then maybe pass on. You know, living with a non-communicable disease, whether it's hypertension or diabetes or being a cancer survivor, is stressful in and of itself. Managing the disease, ensuring it's under control, for cancer, ensuring that it doesn't recur. I mean, these are very big, stressful health situations. And when you add the COVID-19 pandemic and stress about, will I get sick and will I, you know, be seriously ill from COVID because I'm at higher risk, all of this additional stress adds on, let alone all the stress with the social and economic situation that COVID-19 has brought on. So, you know, as we've been emphasizing at PAHO through the mental health program, the importance of just taking the time to take care of yourself, all of the self-management supports that are needed, and the connection to the social support networks through friends, through family, through physical activity, through taking walks in nature and communing with nature, cooking, music, dancing, whatever it is that kind of brings peace and calm. I know personally, I like listening to stand-up comics and getting more humor in my life to relieve some of the stress. And so I just wanted to make that pitch out to all the listeners to just find your stress reliever, make sure it's a healthy stress reliever, and enjoy it and focus on well-being. Over.
Yes, now the question also related to the fact that this lady's dad has hypertension, he's forgetting to take his medications. Should she encourage him to be constant? And the answer is most definitely be constant. Yes, take your medications. Try to find some system of taking medications. You might have to get a pill dispenser and maybe set your alarm clocks at a certain time. It goes off, you take your pill. And other ways so that you don't forget, or perhaps have a little calendar in the fridge so you can tick off the day and the time you take your medication. So as an independent reminder. Other things, for example, like reducing your salt consumption is also important. Drinking more fluids, eating healthier. As Silvana said, being physically active. There's nothing worse than being trapped in your home, being physically inactive, hearing bad news on the television all day, you know. So you have to find ways to turn that television off, to go to bed at regular times, get in your physical activity, etc. Be kind to yourself. And I can't emphasize that enough. Because even being at home when one is working has its own challenges. You find that you work a lot more than you would have worked in the office. And so you really have you have to step back and try to find ways to be good and be kind to yourself. And as Silvana said, of course, build your social networks. We've been able to connect with colleagues and friends in other countries, which we have never done before. And it really is really very gratifying, building in relationships that you may not have had for 20 years. Absolutely wonderful. So they talk about social distancing. That concept is totally wrong. It's physical distancing, but work on being socially closer.
Thank you, Dr. Ennis. Yeah, that was also something that was emphasized very strongly during our discussion a few weeks ago about mental health, that it's so important now more than ever to stay connected to each other. And that brings me on to another question that we've received from Faye in our chats, which is about the public health measures that are being implemented in the vast majority of countries in our region, particularly and many countries in the world. And of course, one of those is the physical distancing that you mentioned. And many countries have emphasized that that's particularly important for vulnerable populations in which people with NCDs would fall. So if you have an NCD, is it best to just stay at home as much as is humanly possible and avoid contact with infected persons? How important is it to adhere to those public health measures?
So I think that's an excellent question, and I note that Faye is a nurse, so it's a particularly relevant question for providers who are in a situation where they may be at higher exposure. So context does matter. The community transmission rates in your local community matters. Your exposure in your workplace matters. And all of the infection prevention and control measures that are being recommended are much more applicable to those living with an NCD. So wearing the masks, washing the hands often with soap and water, the physical distancing, staying at home as much as possible. But of course, we all need to make a living. We all need to carry on, and following the restrictions that are put in place by governance in your local community to reduce that community transmission and to reduce that population risk is really important. Over.
Thank you very much for that. And just before I go into my final couple of questions, we've also had another question from Natalia, which is, and I'm sure we have the resources, we just need to point people in the right direction, which is, where can I find more information on how to care for patients with hypertension and diabetes?
Mm-hmm. Yeah, we definitely like to have the audience visit our PAHO website, which has just a abundance of resources for an entire primary care teams, as well as the just different audiences, the general public. And I know we will be posting the websites. In addition, for primary care providers in the entire team, we have a virtual campus platform. And in the virtual campus, we have also a great diversity of virtual courses that are entirely free, that are available 24/7 for people to do on their own at their own times, and very, 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 very rich with top, world top presenters. And at the end of the course, people will receive a certificate by PAHO for the completion of the course. So we have virtual courses on hypertension management for primary care teams, secondary prevention of cardiovascular disease. We have a virtual course on the implementation of a strategy known as HEARTS, as well as in mental health. There's a very rich portfolio of courses on suicide prevention and many other resources that is freely available. And for some, this has meant a shift in their work status. This is also maybe a time where enhancing and honing in some of those skills may be appropriate. So we definitely invite you to visit those resources.
And if I could just add that, I think this is one of the major points, is that we want to raise awareness and understanding of the public, of the health providers, about those links between NCDs and COVID-19, because I think it's one of those understated, perhaps not emphasized enough points out there as we talk about the COVID-19 pandemic, but this group of people, 200 million people in our region of the Americas that are at higher risk of COVID-19. So please, yes, just to echo Gloria's remarks, visit the PAHO webpage. We have a lot of information, fact sheets, materials for the public and providers.
I might interject here a little bit to build on what Gloria said too about, she talked about HEARTS. And HEARTS has been a program which has been rolled out. It actually was first tested in Barbados in an earlier form about hypertension control. Hypertension control is one of the most significant ways to impact cardiovascular disease by controlling blood pressure. And quite often people with hypertension don't know they have hypertension because it's silent. It's one of the so-called silent killers, and by the time it manifests, there's already evidence that organs are damaged, such as the heart, etc., heart, kidneys, blood vessels to the legs, and peripheral circulation and so on. But the HEARTS program, basically, it strengthens the delivery of care at the primary healthcare level. So it, for example, it helps improve management of chronic conditions. It uses algorithms which are based on certain medications given in a particular sequence. It has a team-based care approach. So it's not just your physician, the nurse, the pharmacist, everyone is involved in your care. It's patient-centered services. It's feedback in terms of control using a registry, etc., based on information systems. And this has been shown to improve hypertension control. For example, in Barbados, about a year or so later, blood pressure control increased by as much as 15+% by virtue of implementing the HEARTS-based protocol in Barbados. And it makes a huge difference. So this is just to build a little bit on what Gloria was saying. Then if I may respond, Ashley, to a question I see in the chat. And the question is about how has the pandemic impacted primary care services?
I was
Silvana,
just going to ask that to you.
Well, Silvana actually spoke to the question, but just to reiterate, because it's such an important question, and I actually have some numbers in front of me, and it spoke about what happened in the region of the Americas, and there was partial disruption or complete disruption, and in fact, in the region of the Americas, hypertension management disruption took place in about 60% of countries where there was response. So disruption affected about 60% of settings in the region. Diabetes and diabetic complications management, disruptions about 60% of the clinical settings in the region again. Urgent dental care. And we often don't think about dental care, but imagine having a tooth that is painful. 42% of these services were disrupted in the region of the Americas. Cancer treatment, similar disruption, partial disruption, 42% of cases. Asthma services, disrupted in a third of the cases that were reported. Rehabilitation. Now, of course, during COVID, people need to have rehabilitation, physiotherapy, etc., after being extremely ill. It was fully disrupted in as many as a third of the cases. And palliative care services were disrupted in as many as 4 to 10 care settings. So there was significant disruption. This is not just primary care. This is primary, in some instances, secondary care. But it reflects about that there were significant disruptions as a result of COVID. And quite often, because elective services were closed down, or people were sent to be part of the COVID response. So I think this really was an eye-opener for many of us. And it speaks to the need for having resilient services that are resilient and adaptable, and to find ways, and we chat a little bit about delivery of care through telemedicine and telehealth, etc., but trying to find ways so that we are not in this situation going forward in the future.
Thank you, Doctor. That was very interesting about what you were saying about dental care, particularly because I think, we've spoken a lot about, some of the primary NCDs and the primary healthcare services, but, things like dental care can, obviously lead to infection and have a tremendous impact on people's well-being and health outcomes. I wonder if you could just talk to us a little bit more about, because since the beginning of the pandemic, one of the main calls has been for countries to reorganize health services to be able to cope with this influx or potential influx of patients with COVID-19. But now that we're seeing some of the numbers that you mentioned, I think it was 60% of people with cancer that aren't accessing treatment, or that it's impacting 60% of cancer services. What can be done, and what recommendations are we sort of offering as far as minimizing these disruptions to ensure that countries offer continuity of care for these patients that have very critical health needs?
I'm actually in a very unique position of having someone who is our expert in cancer services right here in the room. So I'm actually going to let her take the question first, and if I need to come in, I'll come in after. So Silvana, I'm going to deflect this one to you.
Sure. Okay, so the issue of service disruption and how do you minimize the impact of those service disruptions on the care of the individual is a really complicated one. It's a complicated question, and it's so dependent on the health system and services in the local community or in the country, right? You know, the first and obvious solution to minimize the impact of closures and disruptions in services is to triage patients and to prioritize them based on the severity or gravity of their condition. So, for example, if it is a cancer patient, is to determine those that are at highest risk and need most immediate treatment, whether it is surgery or whether it is chemotherapy or radiotherapy, and then to prioritize them over others that may need, say, for example, follow-up care, but have already had treatment. So it's a triage and a prioritization based on the gravity and seriousness of their condition. That's the first approach. The second, of course, is the use of telemedicine, right? Which, as Dr. Hennis already noted, is not widely available everywhere and tends to be localized in urban centers, in countries that have more developed health systems, that have more health resources. But certainly this is one of the stopgap measures that are being used. And then in terms of accessing medicines, because interrupting your supply of medication, if you're diabetic or if you're hypertensive, can be life-threatening. And so we are, you know, reinforcing that there needs to be in place measures so that patients can ensure receiving their medications. One of the measures is extending the prescription period from 30 days, which is typical, to 90 days, so that people don't have to go to the pharmacy often, so that they have their supply with them. Another measure which we've seen in some of the countries in our region adopting is this sort of mobile pharmacy, if you will, where they will have a registry in the health service of all of those with a chronic condition that need to have access to their medicines, and they will make efforts through the health services using community health workers or other community agents to follow up door to door with these people. Now, of course, it's all dependent on, again, the health systems and resources in that country, but these are some of the innovations. And we talk about building back better, right? So after COVID-19, once the pandemic subsides, hopefully soon, we would like to focus on building that stronger health system that can ensure the continuity of care for people with NCDs, and use some of these innovations that have been put in place to ensure that all people receive the care that they need on a continuous basis.
Thank you very much, Silvana. I just have one final question, and I suspect it's going to be for Gloria, but you know, if anyone else wants to weigh in, please jump in. So we've spoken a lot about what we need in terms of health service continuity. So, you know, putting a lot of the emphasis on governments and ministries of health, I suppose. But when it comes to supporting people in their own self-management, which I think ties into a lot of the questions that we were talking about initially, what needs to be done to ensure that people can take responsibility for managing the care of their, you know, particular condition as an individual?
Mm-hmm. And I think that it is very important to look at context, and it's being brought up again that environment plays a major role, and that of course health services, what this crisis has done is that it has unveiled many of the gaps, existing gaps that weren't new, and it just have been lifted. However, we also know that there is strength in community, that there is strength in that there's, you know, people's power. So I think values such as solidarity, resourcefulness, that we oftentimes see them in times of disaster, right, or a natural disaster. This same type of responses are active now, and people within the context of COVID, which has that added compounded barrier of physical distancing, there's trying to find ways of connecting through other means. So that the power of community and support to sustain, for example, new habits. If I'm trying to make a change, it's so much more difficult to make it on my own. So, but if I am able to engage a family member, of a couple of family members, or engage a neighbor, even if we may not be able to be physically in the same room, that has an important influence in how well we can maintain habits or these new healthy habits that we might want to be putting into practice during this time. There is also those natural leaders in our communities, those community helpers that we should be tapping into, although they may be overstressed. So that's also to pay attention, to be mindful of. But I would say again, Dr. Hennis referred to the opportunities that this crisis gave us, the opportunity to reconnect with people that we might have been stranded from. However, this was a perfect pretext for reconnection. So I would conclude by saying that do not underestimate the power of community and solidarity to help us through, and to make, even if there are individual changes, we still need that support and that social support in order to make them happen. Okay.
Thank you, Gloria. So to go back to Dr. Hennis's points, to really hit it home, it's physical distancing, not social distancing, that's key, really. And also, just before anyone else wants to jump in, the vast majority of our audience today live in the Caribbean region. So that's a region that has known disasters, that has overcome, weather-related disasters, et cetera, so particularly equipped to be able to achieve some of the things that you mentioned, Gloria.
Ashley, if I could just jump in and just support what Gloria has said about this community, because I think that's what we're trying to do here with this Facebook Live, is to create this community of cared and concerned public health professionals who, whether you're somebody who's living with an NCD, whether you're somebody who's concerned about COVID and NCDs because you're family members, or whether you're a provider who's caring for people with NCDs or people with COVID, that we're trying to really create this community where you can seek information and support from us. We have these Facebook Lives. We also have information on our webpage. We have webinars on mental health, on different NCD topics. And so what we're trying to do is this virtual support network as we're all struggling with how do you manage this double burden of COVID-19 and NCDs. So yeah, so you're not alone, we're here to support.
Yes, and we all have a role to play, and I think very certainly also in addition to the community that we're talking about building and that we need to strengthen, we also have to encourage the governments to basically strengthen the primary healthcare systems and invest in universal health coverage. I think this is so critical as we have seen the impact of this. I wouldn't just say double burden, it's even a triple burden of things that have gone wrong, social, health, and economic confluence of these various pandemics. And we haven't even talked a lot about the mental health pandemic either, which is another topic of its own. So I think when one sees the impact on our health systems and on health, it really behoves us all to work towards strengthening the primary health care system, which is really where services are available to people in the community, where they are at the center of the healthcare system. We have to strengthen our health delivery networks. And there also has to be this investment in health, which is at least 6% of public spending. So these are many things that we speak about. We have to strengthen the regulatory framework to decrease exposure to substances that are harmful to health, like tobacco, harmful use of alcohol, physical inactivity, and junk food. If, for example, we had made the progress that we should have made by this time, based on WHO agreements and resolutions and mandates, we would probably be in a far better position now. As a simple example, in the Caribbean, there was an ideal to make the CARICOM region tobacco-free by 2022. This is 2020. We have several countries and several islands which have not yet put the mandates in place and the regulations in place to make the CARICOM region a tobacco-free region. This is a very simple regulation and legislation that saves lives. There's no level of tobacco that's safe. And therefore, as we talk about doing things because the time to do them is right now, this is another thing that we need to consider and to really get civil society behind, because in the end, we don't have a lot of time. And we need to do what's in the best interest of our citizens to save lives and to create better health for all. The time is now.
Thank you very much, Dr. Hennis. We're getting right to the end of the Facebook Live session. We just have another 5 minutes to go. So given that the topic of this Ask the Expert was what healthcare providers and patients need to know about non-communicable diseases in the context of COVID-19, I just wondered, given your sort of fairly separate yet together focuses, whether you each have one short overriding thing that you think is probably one of the most important things that either healthcare providers or patients or both need to know about NCDs in the time of COVID-19. Should we start with Gloria?
Sure, and it's just the opportunity to reiterate with the audience. Well, first, thank you for being with us. And if you have the time and had the opportunity to participate in this forum, it shows you great initiative, and you are really a person in your community who can multiply this message, who can share the resources that we share to those that might not have been able to join. So thank you, and we appreciate your time as well. And self-management, patient empowerment and patient engagement are key to get us through these difficult times. Thank you.
Thank you, Gloria. How about you, Silvana?
Sure. So my message would be to all of those out there who are living with diabetes, hypertension, or any other non-communicable disease to control your disease by taking your medication, following the healthy lifestyle and all the advice your doctor gives you, but also at the same time, reduce your risk for COVID-19, being mindful of all of the infection prevention measures, wearing a mask, physical distance, washing your hands with soap and water, and stay healthy and well balanced, and stay well.
And Dr. Hennis, last but not least.
Yes, and I think really it's a matter of speaking to the people themselves. One, and as Silvana says, you need to do your part regarding yourself, prevention and trying to protect yourself against getting COVID by all the measures she spoke about, and also doing your part to prevent yourself getting non-communicable diseases and living a healthier lifestyle, which obviously means, cutting out junk food, sugar sweetened beverages, harmful use of alcohol and tobacco, and those topics. And really, the other pleas really to governments to really step up to the plate as far as possible to put systems in place where the easy access to and the lifestyle and the environment in which you live makes the easy choice the healthier choice. And I think that's always going to be an important responsibility at a level of governments. And I think it cannot be profit before person. People have to come first. We have to invest in people or citizens who are greatest assets, development, etc. And I think we have seen that the impact of something like COVID-19 can reverse all the gains we have made in a matter of a few weeks or months. So we have to do the right thing at all levels for the well-being of our communities going forward.
Brilliant. Thank you all so much. I think it's been an incredibly interesting conversation, and I thank you for taking the time out of your very busy schedules to do this today. Join us next week. Thank you for joining, but join us next week again for our next edition of Ask the Expert, same time, same place in English. We'll have the Spanish one in the morning as per usual, and I'll talk to you all soon. Thank you. Bye-bye.